You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, teeth in a day. According to my first guest, you could walk in his office with broken down teeth and walk out with a beautiful smile on the same day, oftentimes in just an hour. With us, we have Dr. Sutherland. Dr. Sutherland, welcome to the program.
It's a pleasure to be here.
Now, people can walk in, right? I mean, they've made an appointment over the phone.
Right.
And they have pretty bad teeth.
Right.
And in the same day, you can fit crowns and they walk out and they're done.
Yeah,
That
absolutely.
happens?
Absolutely, every day. And not only crowns, but when we get into the procedures that need more than a crown just to save a tooth, we can fit all of that in usually within a couple hours.
So you have your own lab?
Yes, yeah. We have our own lab. And most of the dentistry, though, has gone in this digital direction where a lot of it's made without a lab technician on a CAD/CAM computer where we can make the crowns right here in one day.
Now, I haven't seen this firsthand, but in your office, it's like a wand that goes in their mouth.
Yeah, we actually have a computer, and on that computer is a camera. So after we get the tooth ready to go, we go ahead and take a picture of that tooth. We then design the crown right in front of the patient as they're sitting there watching. And once we have it done where it fits into the mouth, we go ahead and send it to a milling machine. It mills a crown out of a tooth-colored block.
And that's in your office?
Yeah, right
this
in the
milling
office.
machine, okay.
In fact, the patients watch it as it's happening. We mill it out, and within about an hour, the tooth is customized and ready to go.
And how soon can they eat and chew and do all that stuff?
They can eat right away. They may be numb for a little while when they go home, but they can eat and chew, and it's completely done when we bond it into their mouth.
So who is the typical patient that comes in for this same day crown? I mean, what type of problems would they have to make them a great candidate for this?
Yeah, I think we have two main types of patients. We have our patients that walk in with a specific problem. They broke a tooth or broke part of a tooth around an old filling, and they want that tooth fixed. And that's easy to do.
You do that every day?
We do that every day. And then the other patient is the one that comes in and wants to know if they're healthy. And they come in, we look in their mouth. In a typical case, a lot of people had cavities as kids and had large fillings put in these teeth. And over the years of eating and chewing, these teeth break down. And because cavities often don't hurt, they have no pain. They don't even know the tooth is rotting underneath this old filling. So we can take some pictures and show them what's going on and come up with a solution to fix their problems.
You also do same-day root canals?
Yeah. Yeah, and the root canals...
Tell me about that.
Root canals are a procedure I avoided for years. I used to feel I sat there and filed on a patient's tooth, which was for hours. It was torture for me, it was torture for them. But the problem with digital dentistry is that if I'm working on a tooth and it needs a root canal, I can't finish my crown. So I have to send you to a specialist across town or even in my own office, but it takes more visits.
Interesting.
I found a procedure a couple years ago that was root canals performed with a laser. And there was two great things about it. One is it's performed quickly. And two is we don't have to file the tooth as much. We don't have to destroy as much good tooth. So we are able to thoroughly disinfect the tooth without destroying good tooth. And I can do it actually in the same time the crown's being made. So we can have, again, everything done at the same time.
Does it cost more to go to a same-day guy like you?
No, most of the time I found it costs less. We have the machine. We're able to mill the units at our office for a lower price. We don't have to pay for a fancy lab. We don't have to pay for shipping costs to send it across town. Things can actually be done in less time. And in our dental offices, our chair time is valuable to everyone. So it all comes down to they actually pay less for a procedure, even though it saves them more time at home and more time away from work.
Okay, good. So what if their mouth is really falling apart? Just a complete mess. Do you ever get those? And those can also be done? Like they walk in with bad teeth and they walk out with a bunch of nice teeth.
Every week we have patients that come in and that they need a lot of things restored, a lot of different types of dentistry done in their mouth. I had a really nice lady come in last week. She needed her lower teeth repaired with crowns. And some of those, when we got in there, need root canals, so we did that and we finished on the same day. Her upper teeth were not savable. So we had already made a pre-made set of teeth for her. We actually pulled out the remaining teeth that weren't savable. We replaced implants in there and put the permanent teeth at that same procedure. We had an anesthesiologist that put her to sleep. She woke up and everything was done. And when we go home, some of those things need to heal. So in those big cases, so we actually end up doing a final restoration a couple months later, but they leave with teeth in those cases that day that they can smile and they look great. we tell them not to do too much on those teeth. Well, the next day she had a big party planned. So she came to me the following week and she told me that, you know, I know you told me, doctor, not to eat on these teeth with anything real hard. She said, but I had this apple tree back in my backyard where this party was. And I went back there and I had to take a bite out of this apple. And so she took a bite, you know, and everything worked out good. She found out she can actually chew something again in her life. And she was so happy when she came back.
So what do you say to a person, because I have a cousin
Right.
that was about to get some work done, a crown. In fact, they already started the process. And I said, oh, they said they're going to get their crown in a couple of weeks. And I talked to you, right? And I said, you know, there are dentists that do this in the same day.
Right.
And they're far from you. But so what do you say to the person that wants to find a dentist that does the same day technology?
I invite them to come to my office. In fact, I had a patient a couple weeks ago that came from Colorado. I have a patient that works on the Amtrak and gets stationed all over, which we just completed her whole smile. So it just takes the time to make one trip, but everything's completed in one day. So to take a couple more hours to drive out of their way to get this done is a pretty small inconvenience compared to going to the same dentist 4 times to get the same procedure done. They take just as much time out of their life.
Okay, and because you do it in one day and you have your own machine, you say it's a better fitting crown and that it'll last longer.
Yeah, the computer.
You believe that?
Absolutely. You know, the computers can make crowns that fit better than what we can make with our human eye. They can make it more accurate. The materials we make out of are made out of stronger materials and blocks.